This is how to find a proper fitting endotracheal tube. The size of an uncuffed endotracheal tube is based on the internal diameter, according to the following. If the patient weighs 1.5 kilos or less, you could use 2.5 millimeter internal diameter. If they're 1.5 kilos to full term, use 3 millimeter. If they're just born to 6 months old, you could use 3.5 millimeter. If they're 6 months old to 2 years old, you could use 4 millimeter internal diameter. If they're over 2 years old, you should use the following equations. Now, if a patient has a properly fitted endotracheal tube, it should have an air leak when you apply 20 centimeters of water of positive pressure. An uncuffed endotracheal tube is usually sufficient for a proper air seal, especially in children that are less than 5 years old. This is because these young kids have flexible tracheal cartilage and subglottic narrowing. A cuffed endotracheal tube can be used if you really need additional pressure, but it should still air leak at 25 to 30 centimeters of water. If the endotracheal tube is too large, you do risk laryngeal and subglottic damage. So you always want to make sure you have an air leak in these kids.